I want to welcome all of you coming here this evening, spending your time with us. When the nice weather's back, you could be doing many things. We really do have the most wonderful people who come to Tahoma Clinic because they're informed, they're aware. Every one of you had a connection with someone. You were seeking some improvement in your health. So I just want to commend you on that. I want to say, kind of, as we begin, my own journey began a number of years back when I was extremely ill, perhaps for travels out of the country, I don't know. And it took me many years to find an enlightened, holistic chiropractor who helped me come back to optimum health. I don't say optimum. My journey is still continuing, obviously. But I didn't find that help in many of the conventional circles that I was working within. And that actually inspired me to go to medical school at a later age and become a naturopathic physician. And I feel like I've landed in the best place for this type of care to be presented. And many of you have already experienced it on some level. Now, our topic today is optimum health begins with the stomach. But we all have the option as doctors of choosing our topic, and I talk about this every day with patients. For me, all health begins here, whether I'm treating someone for thyroid, whether I'm treating someone with hormones, hormone replacement. No matter where we're going, we begin here with digestion, with the ability to absorb nutrients, and so forth. So I'm assuming people are here because they're on this path as well. Are there folks here who feel like digestion is an obstacle for them? Hands, okay. So we're going to begin this journey together. I'll present some information that you may know, and you'll get more in depth on that. I've heard this expression, you are what you eat. And this is even more important now than ever. What that includes, and to the best of your financial ability, eating healthy organic fruits and vegetables, free-range organic chicken, fish, excuse me, not so much free-range, but chicken, fish, meats, and wild-caught fish, and then supplements to support the diet. Now, this will not be a political talk, but if you've heard Dr. Wright's radio show, you read the newsletter, you know that that's part and parcel of some of what we are here. So I want to just make a plug for a movie by the name of Foods Incorporated, Foods Inc. It really is enlightening about what's going on with our food industry. I won't make too much comment about it, but just to let you know that food is quite different than what was being produced some years back. And the reason we emphasize things like free range is that the chicken, turkey, the cows, pigs are eating natural foods for them. They're not being corn-fed. They're not being fed ground up byproducts, those types of things, which can ultimately affect your health. And many people have asked me in private practice, where should I be actually taking supplements? Do I need them if I have a healthy diet? And I'm going to say yes. You do need some of the basics, and this is going to be a topic of a talk down the road that I'll be doing on what supplements to take when. But I do believe that many people have nutritional deficits. Some of it is due to this topic today, poor absorption, but others are basically because our food supply is not what it was. Now, if you are growing your own foods, and I do recommend considering things like gardens, you're raising your own chickens, many people are these days, you probably are getting a better quality of food. But it's something to consider within the limits of your budget. I realize not everybody can afford this completely, but have as clean a diet as possible to begin. But what happens if you can't absorb what you eat? As we age, what happens is that we notice that our digestive enzymes, hydrochloric acid, decrease. Stomach acid declines. We end up with more and more problems in terms of absorption. Anybody here have problems with heartburn or, okay? You don't have to admit it, it's just nice to show of hands. Heartburn, reflux, GERD, those are the common terms that are used for what is conventionally known as too much stomach acid. And I'll talk about it later, but the approach is often using proton pump inhibitors, things that reduce your stomach acid. But what we see is as we age, stomach acid declines for a variety of reasons. We'll see increasing food allergies as the stomach acid declines. We'll see other symptoms of poor absorption, cracked nails. I see that a lot in patients, or the ridges on the nails. You might even take a moment now to look to see if you have ridges. If you have dry skin, dry hair, cracked heels. You can see a lot of those things. But you probably didn't even connect that with osteopenia. I see this in a lot of women even before menopause, and men too. Osteoporosis, bad breath. That is a common sign of poor absorption. Low stomach acid is bad breath. H. pylori. What's interesting, a lot of the conventional treatments were actually developed to treat ulcers, and ulcers are commonly associated with H. pylori. It's a bacteria that is found in association with ulcers. Don't yet know whether it causes them, but we notice that there is improvement when we treat for H. pylori. We do treat for H. pylori here too, but we use not things like Prilosec and antibiotics. We use more natural forms. But I see this in many people with high or low stomach acid. But did you know too that the use of anti-inflammatories, NSAIDs, can irritate the gut, can affect the stomach lining, can affect your ability to absorb nutrients? I think I have to point it. There we go.
There you go.
Okay. So I want to talk about the role of acid in digestion. Talking about that area really from the neck down to the colon. We're talking about this part. But in truth, poor digestion affects the whole body. There are many symptoms that show up that become corrected once we adjust for stomach acid issues. So we did address this. Everyone has a checklist, and then you've given thought to what symptoms might mean to you personally. Okay, here's what we've started on some of this. How malabsorption affects everyday health concerns, and I'll tell you one of the first things that did happen to me is I lost my gallbladder, and here at Tahoma Clinic we actually help people keep their gallbladders. I have some patients who have kept theirs, and many people come in after the fact not knowing. But gallbladder issues are often related to both malabsorption and food allergies. So if you're having any symptoms related to gallbladder problems with fat digestion, then that can be a factor. But it is, again, stomach acid causing sensitization of the stomach lining, malabsorption, and then the gallbladder doesn't actually then release the bile very effectively when you eat a fatty meal. Cancer, probably wonder how that could be related, but when the stomach acid drops, it's too neutral, stomach cancer is a possibility here. You can get what's called atrophic gastritis, sensitization of that stomach lining, and then invasion by bacteria. So we're talking about a variety of things that are affected. The immune function is affected when the stomach acid is not low enough, and because it's our secondary response to the immune system, which fights off infection. Interestingly, one of the side effects, and I have studies on this, pneumonia is a common side effect from people who've been on proton pump inhibitor therapy for a long time. And if you think about it, your stomach is one of your areas of defense against these types of bacterial and viral invaders. It makes sense. Low stomach acid, developing pneumonia, and I've even seen it in people, sinusitis as a problem. Asthma. Childhood asthma specifically, but when we don't absorb very well in the stomach, then we don't absorb effectively in the small intestines. And one of the areas affected is B12 and folic acid. We actually have a proposal out to study childhood asthma and the use of B12 in correcting it. And I just saw today in one of the online journals, basically, B12 and folic acid deficiencies have been associated with lower lung function. So some of these things that we've known here for a long time are starting to come out in the mainstream. And one of the things we do when we have someone come in with asthma as a child, we actually test hydrochloric acid and to see if it's low, and then we treat that. Rheumatoid arthritis, antibody sensitization of foods, other things affecting the joints. And then celiac. You're probably surprised to see celiac disease there. But wheat sensitivity, wheat intolerance is a very big factor that we see with low stomach acid, poor absorption. And then on top of that, the wheat damages the villi of the intestines, and then absorption is extremely poor at that point. I have one patient who was diagnosed very late in life, and he has a chronic condition that is very hard to treat. So catching some of these things early enough is really critical. I meant to ask at the beginning about Optimum Health what your definitions personally were for that, but I'm sure aging well is one of the ways you would define it. Reading that talk about this probably lots more eloquently than me. One is Your Stomach that was written by Dr. Wright. This is more recent than this book, but this one's very complete. The other one is Why Stomach Acid is Good for You. These are very detailed discussions. This one is a very simple read, and I think there are copies around, so if you come in for IVs, you can read this while you're here. But this is detailed, and it goes into a lot of discussion with a lot of the references for things that I'm speaking about today. So these are things we've been working with for many years and have patients improving. So this particular phrase, the medical mistake that often occurs is Dr. Wright's. I won't take credit for that. But it's an apt relationship to what is actually occurring in conventional medicine. Most people consider in the conventional world that GERD, reflux, those types of symptoms actually are high stomach acid. So they put you on what are called proton pump inhibitors, things that lower the stomach acid. The effects are basically that they lead to a poor digestion, malabsorption, and they make the situation worse, not better. I'm not knocking them because there are some times when they're appropriate, but as a rule, the way that they're given is you have reflux, here's Prilosec, now you'll feel better. Well, you may, but one of the things that people have noted is that you can get rebound hyperacidity. You can increase the acid level, not decrease it. In fact, that's what the body has to do in order to digest. You decrease the acid, and then one of the enzymes basically raises the acid level until it brings it up enough for you to digest. So it ultimately makes the situation worse, not better, if it is not truly high stomach acid that you have. I give this to patients probably daily, if not weekly, and I have people come back in, and lo and behold, they've lost weight, they're glowing, they feel better, their GERD is gone, and that's the best indicator to me that this is working, even when they've been on things like Prilosec, omeprazole, that type of thing. The way it's described, the way I describe it to patients, and Dr. Wright describes it as well, is starvation in the face of plenty. When your stomach acid is low, you try to eat in order to take in enough nutrients. And in fact, can even find yourself drawn to foods to replenish what you don't get in. So decreasing the acid only makes that worse. So I mentioned earlier pneumonia as a possibility, decreasing acid, increasing osteoporosis. So there are many different side effects that can occur. So what do we do? Or what can you do? One of the ways that we find out what your stomach acid level is we do pH testing with a machine called the Heidelberg pH test. And when I describe it, sometimes people think it sounds a little uncomfortable, but it's really very comfortable. Most people end up taking the test and saying, oh, that was nothing at all. What we do is take a capsule, one that you can swallow comfortably. It's attached to a string. We have you swallow it down into the stomach. I know it sounds kind of gross, doesn't it? But it's attached to a string, and we do tape it to the side of your cheek so you don't swallow it completely, so we can pull it back out. Well, truly, we do it in this room over here, and then I see people there sitting there with the string hanging out of their mouth, and there's a little thing that it's attached to the side, so you can't swallow the whole thing. But what it does is it basically gives us a printout, like an EKG, of your stomach acid. And what we do is we use sodium bicarb, the very same thing that your body has or produces. And then we watch and see how you neutralize that. And then depending on the speed with which you do it, we either say you have normal stomach acid, you have low stomach acid, or you have high stomach acid. Honestly, we've done hundreds of these, and probably in this clinic, thousands and thousands of these. I've only had a couple people come back high out of everyone I've tested. A number do come back normal, and we take a different approach. But many, many people with these symptoms come back low stomach acid. What we also do is we'll do an amino acid assessment, because if you're not absorbing very well, you're not also absorbing amino acids, which are the protein building blocks for your body and neurotransmitters for your brain. We'll do food allergy testing. We'll see if, based on this, you have developed food allergies. If the pH test comes back neutral, normal stomach acid, then we put more importance on some of that. And then basically we often will do a trial of hydrochloric acid and digestive enzymes to see how you do. And many people do very well, most people do, and we see a lot of the symptoms improve. I'll see it in nails, for example. We'll see it in hair. We'll see it in the reduction of the reflux, and so on. So these are therapies that do work, and people feel well. And then what is especially important to me is once we start correcting the problems of absorbing things, supplements start to be used effectively, and we can work on other health issues. And this is why this is so important. This is the building block for health. We can then talk about adjusting thyroid and seeing effectiveness with that. We can talk about hormones and see that become very effective. So we're not battling things that are in the way. We're removing obstacles to cure, to kind of use a naturopathic term for that. So this is health. Is it going to go? Yes. Sometimes it isn't low stomach acid. And if it isn't, or we want to do symptom relief, then we'll use something called zinc carnosine. Zinc carnosine actually has a healing property to it. It helps heal the lining of the digestive tract. Refluxin is something that, the way I've heard it described, it's like a a fire hose or taking something to put out the fire. We just spray it on, and that helps neutralize the symptoms of stomach acid. DGL is deglycerinized licorice, a really, really fun way to neutralize, let's say, high stomach acid or indigestion. All of these things you can use intermittently. L-glutamine, if somebody has had damage to the digestive lining, L-glutamine is very healing. Even cancer patients can use this very effectively. And we also mentioned before the probiotics. That's something I would routinely give someone, no matter whether high or low stomach acid.